I'm Dr. Chaithra S.K, Consultant Fertility Specialist from Ovum Fertility Centers, Bangalore.
What is embryo transfer and its techniques?
So, embryo transfer is the final crucial step in the treatment of IVF. So, here the predetermined number of embryos are loaded to a soft catheter and is passed through the vagina and cervix to the upper part of uterine cavity and will be placed there under ultrasound guidance. Generally, this procedure does not require any sedation or anesthesia and is often painless. There are two types of embryo transfer. One is a fresh embryo transfer, the other one being the frozen embryo transfer. In fresh embryo transfer, following egg retrieval, the eggs which are obtained are fused with partner sperms and the resulting embryos are transferred back to the uterine cavity of the woman 3 days or 5 days after the oocyte retrieval. So, for the person to undergo a fresh embryo transfer, the woman should have a suitable endometrial thickness and suitable hormone parameters and also not at risk of any ovarian hyperstimulation syndrome. In case if any of these parameters are affected, the woman will be counseled for a frozen embryo transfer, where after 3 to 5 days of embryo culture in the lab, the embryos will be frozen, and after about 1 menstrual break, the embryos will be transferred back to the uterus of the woman after a suitable endometrial preparation using hormone replacement therapy. Both fresh and frozen embryo transfer give comparatively good results, and this final step of embryo transfer is the most crucial step in an IVF treatment. So, there is often no need of anesthesia for this procedure and will be done using a daycare procedure, and the patient would be discharged same day. Following the embryo transfer, certain luteal phase medications in the form of progesterones, estrogen and blood thinners, folic acid and other supplements may be given in order to enhance the success rates. Following embryo transfer, about 14 to 16 days later, pregnancy can be confirmed through a blood and urine test.